welcome to our show, Health and Wellness, Myths and versus Facts. I'm Gargi Rawat. Now, the definition of health goes way beyond the absence of disease. The pandemic has brought mental as well as physical health and wellness to the forefront, and it's crucial to raise awareness of health concerns among communities. The absence of inaccessibility or inaccuracy of information and a lack of knowledge is worsened by myths and fears as well as increased social media trust. The rapid spread of the new variants offers clues as to how SARS-CoV-2 is adapting and how the pandemic will play out over the next several months. The World Health Organization said the highly mutated Omicron variant of COVID could change the course of the pandemic. People's lifestyles are already severely disrupted, and because of which more and more young adults are being diagnosed with serious metabolic diseases such as diabetes and heart disease. And knowing about the warning signs and problems associated with these conditions can make it easier to manage the disease. And we have experts to give you that information. Today we're joined by Dr. Moiz Topiwala, consultant physician and diabetologist, Apple Hospital, Indore, Madhya Pradesh, and Dr. Narasa Raju Kavalipati, interventional cardiologist, Apollo Hospitals, Hyderabad. Thank you so much, doctors, for joining us on the program and, answering all these questions and, arming us with this information that's so important. Dr. Topiwala, I'd like to start with you. And some people are already suffering from the long COVID effect. So are these people then more susceptible to Omicron, and what extra care should people with comorbid conditions take?
So, I would like to start by thanking NDTV 24/7 for giving us this platform to connect to the audience. Your question actually has two parts. First, if we want to talk about reinfections. So yes, the person who was once infected with COVID-19 disease in the past, we have this Omicron is very notorious. So the chances of getting reinfected with Omicron is higher as compared to the other variants. To the person who were initially infected by some other variant of the COVID-19 disease. First, and second, the persons having comorbid illnesses, yes, they land up into serious trouble. They have more mortality, they have more problems with the course of the illness. So the precautions they have to take always remain the same. With even minuscule of their symptoms definitely they should contact their doctor. They should get vaccinated as soon as possible.
Using masks, proper social distancing and sanitization remains important for everything. Thank you.
All right. Dr. Kavalipati, how does the heart get affected by COVID infection, post-COVID infection? People with, heart disease should take what kind of care to avoid any sort of complications?
Yeah, good afternoon, everyone. Heart can get affected in COVID-19 infection by multiple means. COVID increases the tendency to have blood clot formations. These clot formations can happen in the veins or in the arteries. When it happens in the arteries, it can lead to suppose it's an artery to the heart, it can lead to a heart attack. And the clots in the veins can migrate into the lungs and produce a potentially fatal complication like pulmonary embolism. So these are the various ways in which COVID can affect. And other than this, there are some immunological responses like a myocarditis, where the heart muscle goes into a kind of inflamed state, heart becomes weak in its function, blood pressure can drop, and what we call a cardiogenic shock can ensue in a severe COVID-19 infection. So these are the various ways in which heart can get affected. Somebody develops heart ailment or heart related complication in COVID, they should be on blood thinners and they should have frequent visits with the cardiologist to see that their heart function completely recovers, and we have medications to bring back the heart function to normalcy.
All right, doctor. Also, doctors tell people that after they've recovered from COVID that they have to be very careful when they get back to normal life, and especially get back to, what exercise routines they followed earlier. If you could just tell us a bit about that.
Yeah, so when somebody has recovered from a severe COVID-19 infection and they have a weakness of the heart, these people should take some time to bring back their lifestyle to the normalcy. Like they should not be starting on vigorous exercise regimens, and they should not be doing all these vigorous activities till the heart function normalizes and their inflammatory state comes down to normalcy. This is just to prevent a further episode like a heart attack or further complication like an arrhythmia, where the heart muscle, when it is getting affected by COVID, can have arrhythmogenicity, what we call, where the rhythm abnormalities can ensue, and so this care has to be taken.
All right, Dr. Topiwala, it is known that diabetes can lead to a variety of complications. Are these complications preventable, or are they going to develop, one by one over a period of time? Is it something that's inevitable?
Yes, diabetes brings an array of illnesses. Now, we usually divide it into two major groups of complications like micro and macrovascular. To make this statement easy, we can understand that diabetes leads to stroke, paralysis, can also lead to heart failures, severe heart attacks, and diabetes can also lead to kidney failures, renal failures, and can also lead to small vessel illnesses like neuropathy, retinopathy, causing blindness.
Right. Dr. Kavalipati, now coronary artery disease is the most common type of, heart disease. It can cause serious heart damage. What exactly is this, and is it possible to cure or reverse coronary artery disease?
Coronary artery disease is basically a disease of the coronary arteries which supply blood to the heart muscle. Heart muscle, is a completely dependent on continuous supply of oxygen and nutrients, because it's a continuously working organ. So coronary arteries do the job of supplying oxygen and nutrients to the heart muscle, and when these vessels are blocked, that disease is known as a coronary artery disease. Basically, coronary artery disease is nothing but blockage formation of the coronary arteries. So this is totally preventable and curable. So when somebody develops these blocks, we have medications which can take care of the blocks, and we have procedures like angioplasty and bypass surgery which relieve the ischemia or the lack of blood supply which ensures because of the blockage formations. And though the disease process is totally not curable as such, but the effects of the disease can be mitigated by addressing the blockages by means of mechanical means or by pharmacological means. So coming to the reversal, so the borderline kind of blockages which form in the blood vessels, especially in the early stages when we identify these blocks, nowadays we have very good medications which retard the progression, and to some extent we can have a regression of these blocks also. So we can say in this modern era we have enough treatments to take care of the coronary artery disease by mechanical means, by medical means, and we have also methods to prevent and reverse the coronary artery disease to some extent.
All right, Dr. Topiwala, many people with diabetes have episodes, instances of dangerously high blood sugar levels, that's hyperglycemia, or then they have dangerously low blood sugar levels, hypoglycemia. So what are the causes for this, and how can one manage these conditions?
Both of them are actually very bad. Now, hypoglycemia means going your sugars at a dangerously low level. It is again divided into stages like level 1, level 2. Now, level 1 is when the sugar goes below 70 to the range of somewhere around 55. If level 2, if it goes below 55 on your glucometer readings, and level 3 when the patient is completely knocked off, like he becomes totally unconscious and he requires urgent hospitalization and care. And hyperglycemia, similarly, the sugars are touching sky high and the patient has multiple vomitings, abdominal pain, and becomes unconscious. The most common reasons are when you are not actually following your regimes properly. You are not meeting your doctors. If you have taken your insulin and you forgot to take your pill, or if you forgot to take your meals, you are taking your meals and you forgot to took your pills or insulin, that is the most common cause of causing hypo as well as hyperglycemia. Then any concurrent illness, if you are suffering from any illness, for example like COVID-19 or anything, it can again cause hypo or hyperglycemia. And renal failures, so patient developing kidney or renal failures, they usually try to develop such kind of illnesses. One should get immediate medical care if there is hypo or hyperglycemia. There can be one take-home message in this. Hypoglycemia, considering a normal condition, I would suggest 1.5 tablespoon of sugar which can be dissolved in water and to be taken, to keep on checking your sugars every 15 to 20 minutes. This is something which is easy, can be done at home.
Right. Dr. Kavalipati, is it possible for a person to have heart failure without even being aware of it? And is it possible for someone to not notice that they're having the symptoms for heart failure?
Yeah, it is quite possible that somebody with heart failure may not have any symptoms. In general, when the heart muscle becomes weak and starts producing failure, and this usually manifests with symptoms like fatigue, exertional fatigue, breathlessness, swelling of the legs, and palpitations, etc. But population-based studies have shown that about 50% of the people who have a weak heart, they don't manifest with any of these symptoms. In fact, they are all sitting on a potentially condition which can lead to symptoms of heart failure, or sometimes these people can have an increased risk of sudden hospitalization for a heart failure or sudden cardiac arrest. So these are the individuals who have, high blood pressure, uncontrolled sugar, obesity, sedentary lifestyle. Some of these individuals are prone to have this kind of a picture where they have a reduced heart function, but without having any kind of symptoms. So these individuals can be identified only by means of investigations like an ECG or an echocardiogram and certain markers of heart failure, which are like blood tests. So these are clinically diagnosed by cardiologists after these investigations, and these individuals have to be educated to have their heart failure well controlled and treated.
All right, doctors, thanks for giving us all that information. We'll slip into a short break and return with more questions for you. Welcome back. You're watching Health and Wellness, Myths versus Facts. It's important to have correct information about our health, to watch out for symptoms so we can deal with them earlier rather than later. Doctors with us are answering all your questions about diabetes and heart disease. And Dr. Topiwala, diabetes can affect the action and health of the kidneys if it's not managed well over a long period of time. What are the signs and symptoms of diabetic kidney disease that a person with diabetes needs to watch out for?
Yes, so to understand the gravity of this question, now diabetes is considered as the most common reason for kidney failure worldwide. So you can understand how common it is. And if it is not being managed well, sugars are not controlled over a long period of time, you can definitely land up into this trouble. What are the initial signs and symptoms which a person can notice is undue lethargy, fatigue, not being able to concentrate, then developing of edema or swelling over the face, over body, over your legs, dropping of your hemoglobin levels, and the rise in blood pressure. Rise in blood pressure can be a real initial manifestation that you are developing renal failures. So yes, these are some important signs and symptoms which one should look for if a patient is developing kidney failure and diabetes.
All right, Dr. Kavalipati, heart attack and heart failure are two conditions that share many of the same risk factors and underlying health conditions. So which condition is the most serious of the two?
Yeah, it is very difficult to generalize the conditions like this. It all depends on the clinical scenario. Acute heart failure and acute heart attack both can be potentially life-threatening and at presentation. And acute heart attacks also can lead to acute heart failure. So acute heart failure also can lead to an acute heart attack. So this is a very complex question. To answer it in a general statement, it's difficult. But in general, acute heart attack has very effective therapies. Now we have what is known as a primary angioplasty, where we immediately address the culprit vessel and bring back the function of the heart and reduce the mortality associated with the heart attack. In acute heart failure, we have a lot of advancements, including pharmacological as well as mechanical means in which we can reduce the burden of the heart failure, and we can bring back normalcy, and we can bring back normal expectancy to life. But to answer this question, acute heart attack and acute heart failure, which is more dangerous, it's difficult, and it all depends on the clinical scenario and the individual patient, and it all depends on that, and not a general statement like that.
All right, Doctor, also, why is it that we're seeing, a lot of younger people having these heart problems recently and heart attacks? And is it something that they're not watching out for? Is it some sort of pressure they're putting on their heart? Even especially if we come back to the issue of exercise and gymming, that's something that as you grow older, you have to be more careful about?
Yes, in fact, anything we do in excess can be, dangerous. Even the gymming or the exercise, when it is done in a very vigorous fashion, even for a fit individual, that can lead to an acute heart attack. Because everybody is, most of the people have subclinical disease, which is like blockages of the blood vessels, which is not clinically significant or not clinically, which doesn't manifest its symptoms clinically. But when they're exercising, they're putting an extra load on that blocked artery, and the plaque can suddenly rupture, can lead to a clot formation inside the blood vessel, can lead to a heart attack. And also vigorous exercise and vigorous gymming can sometimes lead to what are known as arrhythmias, rhythm problems, and these rhythm problems can lead to sometimes, a fatal event. So exercise has to be like moderate. When somebody is embarking on an exercise regimen, it has to be a gradual process. It should not be like, suddenly you start exercising to a very vigorous levels out of your enthusiasm. And why the heart disease is happening in younger people nowadays is because of multiple reasons. Now we have young age onset diabetes, young age onset high blood pressure, and many people are born with cholesterol problems, and these cholesterol problems and the lipid abnormalities, if they are not detected early and not treated, then that can also lead to block formation in the blood vessels, can lead to a young age heart attack.
All right. Dr. Topiwala, what are some of the tips that you'd like to give for, healthy lifestyle adjustment for people who do have diabetes and have, to better manage it?
This is a very good and relevant question for the common public. So, two things. First, there are questions coming in the minds that can we prevent diabetes from adopting a healthy lifestyle? If someone is overweight, someone has a history of diabetes in his or her family, then what are the ways? So yes, lifestyle modification is a very important thing to adopt. There are two important things which is research based and has come out of the trial. First is weight loss, and the second is the workouts, the exercise regime. Weight loss, if I have to say, 7 to 10% of your body weight should go down, and probably in the initial 6 months, the recommended rate which they have said is somewhere around 1 to 2 pounds a week. To achieve this target, now 150 minutes of moderate physical activity should be done within a week. Now, if I have to make this simple, what is moderate physical activity? That means if you do brisk walking, somewhere around 30 minutes a day for 5 days should suffice 150 minutes a week. So this is how you can achieve this moderate physical activity, helping in reducing your weight. This has shown to reduce the chances of getting diabetes to up to 44%, which is a good number. If someone has diabetes and is overweight, then reducing 5% at least of the body weight start helping in reducing your cholesterol levels, as well as your sugars are being managed well, they are controlled well. Quitting your addiction habits, again, very important. Initially we discussed about hypoglycemia. Alcohol is again one of the important things which can lead you into serious trouble. So quitting smoking, avoiding alcohol, these are again regarding adopting a good lifestyle. So again, a very important point. So these are the points which I will highlight in management of a good diabetes.
Right, and doctor, if we talk, about the last 2 years of this pandemic, people's lifestyles have really taken a hit and become more unhealthy. There's been, less physical exercise. They're also more dependence on food from outside. Ordering in has never been easier and, more frequent as we saw during the pandemic. And that has dangers in terms of developing diabetes.
Yes, it's very true. It's very true. That is the reason very often now I see patients coming to me with weight gain. So post lockdown, post first wave of COVID, now people are gaining weights because the physical form and the daily lifestyle has been hampered in a very bad way. Second, as you mentioned, that is getting food from outside, not maintaining the strict diet plan, again giving a very deleterious effect on their regular health. So yes, I would like to say that coming back to the normal regime, adopting a good physical activity comprising of both aerobic exercises as well as strength training. Now, 2 to 3 sessions a week of strength training exercises also help in a good way.
Right, it's important for parents also to inculcate these good habits in children, as all you doctors say that India's ticking time bomb as far as diabetes goes, and more people are developing this. So it's not just about losing weight and looking good; it's about actually having a healthy lifestyle and maintaining that health and avoiding certain bad habits. Thank you so much, doctors, for joining us on the program today and answering all our questions for us. Thank you all for watching at home. Goodbye.